Friends, what if I told you that your body might be sending out subtle distress signals, crucial warnings of a major health crisis, up to a whole month before it actually happens? We're talking about a stroke, a medical emergency that can change lives in an instant. But the truth is, the lead up to a stroke isn't always silent. There are signs, whispers from your body that, if recognized, can make all the difference. Understanding these early warnings is not just important, it's potentially life-saving, offering a critical window to act. Today I want to delve deep into these often missed indicators. Recognizing the warning signs of a stroke early on is absolutely paramount. It's about empowering you with knowledge so you can protect yourself and your loved ones. So, let's get started and learn how to listen to what our bodies are trying to tell us, potentially averting a crisis before it fully unfolds. The first warning sign I want to discuss is sudden numbness or weakness. This isn't the kind of numbness you get from your foot falling asleep. It might affect your face, causing one side to droop, or it could manifest in an arm or a leg, making it difficult to lift or control. This unilateral nature is a key characteristic. If you are enjoying this video so far, please hit the like and the subscribe button now for more insights. Ring the notification bell so you'll always get more helpful tips from health and lifestyle. Imagine reaching for a cup and your arm suddenly feels heavy or unresponsive. This occurs because the blood flow to a specific part of your brain is being compromised. Stroke-related numbness or weakness is often sudden and without an obvious trigger. These episodes are sometimes called transient ischemic attacks or TIAs, mini-strokes. They indicate an underlying problem with blood flow to the brain that could lead to a major stroke. If you or someone you know experiences sudden, unexplained numbness or weakness, seek medical attention immediately. The second critical warning sign is sudden confusion or trouble with speaking or understanding speech. This can be incredibly disorienting and frightening. Imagine suddenly finding yourself unable to process what someone is saying. This isn't just a momentary lapse, it's a significant cognitive disruption. This confusion can manifest in various ways. It might be sudden disorientation about where you are or recognizing familiar faces. Speech problems can range from slurred speech to a complete inability to speak. These symptoms arise because a stroke can affect brain areas responsible for language. Stroke-related confusion and speech difficulties are typically sudden. One moment the person is fine and the next they are struggling significantly. A loved one might observe that their speech is suddenly garbled. Prompt recognition by a bystander can be life-saving. The third warning sign that can appear, sometimes weeks before a stroke, involves sudden vision problems. Our eyesight is something many of us take for granted until it's compromised. When vision changes occur abruptly, it can be a clear indication that something is amiss with the intricate systems that allow us to see. This isn't about gradually needing stronger glasses, it's a sudden, noticeable disruption. These vision problems can manifest in several ways. You might experience blurred vision in one or both eyes, making it difficult to focus on objects near or far. Another common symptom is diplopia, or double vision, where you see two images of a single object. Perhaps one of the most alarming signs is a sudden loss of vision in one or both eyes, which can feel like a curtain or a shade being pulled down over your field of sight. The key here, as with many stroke warning signs, is the suddenness of the onset. If you wake up one morning and your vision is drastically different, or if it changes rapidly over a few minutes or hours, this is a cause for immediate concern. These symptoms occur because the parts of the brain that interpret signals from your eyes, or the optic nerves themselves, may be affected by a lack of blood flow. It's easy to dismiss some vision changes. However, sudden and significant changes, especially if they affect only one eye, should never be ignored. Any sudden, unexplained change in your vision warrants an immediate medical assessment to rule out a stroke or TIA. Don't wait to see if it gets better on its own. Our fourth warning sign is a sudden onset of dizziness or a loss of balance and coordination. This isn't just feeling a little lightheaded from standing up too quickly, it's a more profound and often disorienting sensation. This can appear abruptly and without any obvious cause, serving as another potential early alert from your body. The type of dizziness associated with a potential stroke can be severe. You might suddenly feel unsteady on your feet as if you're about to fall or experience a true spinning sensation. This can be accompanied by difficulty walking in a straight line, a tendency to veer to one side, or a general clumsiness that wasn't there before. This loss of coordination is medically known as ataxia. These symptoms often point to a problem in the cerebellum, the part of the brain responsible for coordinating voluntary movements, posture, balance, and equilibrium. It can also indicate an issue in the brainstem, which controls many vital functions. When these areas don't receive adequate blood flow, their ability to function correctly is impaired. It's important to differentiate this from common causes of dizziness. Stroke-related dizziness is often characterized by its suddenness and severity. The sudden loss of balance or coordination can significantly increase the risk of falls, which can lead to further injuries. Any new, unexplained and persistent or severe dizziness or loss of balance should be taken seriously. Seek medical advice promptly. The fifth warning sign is one that can be particularly alarming: a sudden, severe headache. I'm not talking about your typical tension headache or even a common migraine. This stroke-related headache is often described by patients as the worst headache of my life, or a thunderclap headache because of its abrupt and explosive onset. This type of headache can appear out of nowhere, reaching its peak intensity within seconds or minutes. It's a pain that is often qualitatively different from other headaches you may have experienced. It might be localized to one area or felt all over the head. This specific symptom is particularly associated with a hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures and bleeds into the surrounding brain tissue. The reason this symptom is so critical is that bleeding in or around the brain, such as a subarachnoid hemorrhage, is a life-threatening emergency. The buildup of blood increases pressure on the brain tissue, which can rapidly cause damage. This isn't a headache you can just take a couple of painkillers for and hope it goes away. Its severity and suddenness demand immediate medical intervention. Often this severe headache may be accompanied by other symptoms such as nausea and vomiting, a stiff neck, sensitivity to light, or even a decreased level of consciousness. If any of these occur alongside a sudden, unusually severe headache, the urgency is even greater. The worst headache of your life scenario, especially if it's a new experience for you, should always be treated as a potential medical emergency until proven otherwise. If you experience a headache of this nature, call emergency services or get to an emergency room as quickly as possible. The sixth and final warning sign I want to discuss today is perhaps one of the most subtle and often overlooked, yet it can appear as early as a month or even more before a stroke: unexplained extreme fatigue. This isn't just feeling tired after a long day or a poor night's sleep. We're talking about a profound, debilitating exhaustion that isn't relieved by rest and seems to come out of nowhere, significantly impacting your ability to function. This type of fatigue is different from normal tiredness. It can feel like an overwhelming weight, making even simple tasks seem monumental. You might find yourself needing to sleep much more than usual, or feeling completely drained of energy despite getting adequate rest. This profound lack of energy can persist for days or weeks leading up to a stroke. The brain requires a tremendous amount of energy, and if its blood supply is being subtly compromised, it could manifest as systemic fatigue. The danger with this symptom is that it's so easily dismissed or attributed to other common causes. We live busy lives, and stress, lack of sleep, poor diet, or even a brewing viral illness can all cause fatigue. However, if you experience a new, persistent, and unusually severe level of fatigue that you can't explain, especially if it's out of character for you, it's worth paying attention to. It's crucial to consider this fatigue in context. If it's accompanied by any of the other warning signs we've discussed, then the fatigue takes on greater significance as a potential piece of the pre-stroke puzzle. Listening to your body is key. If you feel an exhaustion that is new, profound, and doesn't improve with rest, don't just assume it's all in your head or that you're just getting older. We've covered 6 critical warning signs that can appear even a month before a stroke. Sudden numbness or weakness, confusion or trouble speaking, vision problems, dizziness or loss of balance, severe headache, and unexplained fatigue. Recognizing these signs is the first, most crucial step. If you or someone you know experiences any of these symptoms, especially if they are sudden or severe, please do not hesitate. Seek medical attention immediately. Time is absolutely critical when it comes to stroke. Remember, early detection and prompt treatment can significantly reduce the risk of long-term disability and can, quite literally, save lives. Thank you so much for watching and for taking the time to learn about this vital information. We hope you have enjoyed this video. Don't forget to give us a thumbs up and subscribe to Health and Lifestyle. Stay safe, listen to your body, and take care.